Are the results of eye bag surgery permanent?
Under eye bags, which are present all the time, is caused by fat pockets located under the eyes pushing forward like a hernia. This puffy appearance is often seen running in families as a genetic trait. Bags under the eyes are also associated with aging, sinus problems, and allergies. During the course of a consultation for under-eye bags, patients will often ask me, is the surgery for eye bags that they're planning to have going to be permanent? I'll discuss how I address concerns about the longevity of results you can expect after having surgery for under-eye bags. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. I specialize in cosmetic eyelid surgery as well as revision eyelid surgery for complications referred by other doctors. One of the most popular procedures I perform for under-eye bags is called transconjunctival blepharoplasty. In conventional plastic surgery, under-eye bags are approached by the surgeon making an incision through the skin. This approach is called a transcutaneous blepharoplasty. In this conventional approach, an incision is made just below the eyelashes, so the skin and underlying muscle can be elevated in order to gain access to the fat pockets. In my practice, my preference is to access the under-eye fat pockets through a transconjunctival approach. This means that I'm able to treat the fat pockets responsible for your under-eye bags from the inside of the eyelids, thereby leaving the outside skin and supporting muscles intact and undisturbed. This technique is considered technically advanced and can be challenging for a surgeon in comparison to a transcutaneous approach. I prefer the transconjunctival approach because it allows me to preserve the shape and character of your eyes much more predictably than with a transcutaneous approach. I see a lot of patients for complications from transcutaneous blepharoplasty. These complications include problems such as lower eyelid retraction and ectropion. A common complaint I hear from patients who have undergone transcutaneous blepharoplasty from the outside is that they feel that they've lost the shape that was characteristic of their eyes. They complain that their eyes ended up looking rounded and that they don't look like themselves. In addition, I often see patients complaining of having dry eyes after this approach. Dry eyes can be caused by excess eye exposure or from a too low position of the lower eyelid after surgery. This limits the tear film distribution. Many of my colleagues justify performing transcutaneous blepharoplasty because they want to do something about under-eye wrinkles by removing the skin in order to make the skin appear to be tighter. I respectfully disagree with this assertion on the basis that under-eye wrinkles are caused by a loss in skin quality related typically to aging as well as other contributing factors such as excess sun exposure, smoking, and environmental stressors to the skin. Although it may look like there is extra skin under the eyes, for most people there's actually no excess skin. Essentially, we're not dealing with a skin quantity problem, but rather a skin quality problem. This means that when a transcutaneous blepharoplasty is performed, you can end up with a skin shortage, resulting in problems such as I mentioned before, eyelid retraction and ectropion. Since the main issue with the under-eye skin is skin quality, we can improve the skin quality with issues such as wrinkles and skin discolorations through procedures such as fractional CO2 laser resurfacing. The objective in using fractional CO2 laser is to refresh the epidermis and to strengthen the dermis. The dermis is the foundation of your skin, and precise heat application to the dermis stimulates new collagen production, thereby improving the appearance of wrinkles. I further enhance skin healing and collagen production with PRP, or platelet-rich plasma. PRP, or platelet-rich plasma, is a concentration of the part of your blood responsible for wound healing. Two key aspects of wound healing is the creation of new blood vessels and the production of new collagen, both of which are needed for healthy-looking skin. As mentioned earlier, I sculpt the prolapsed fat responsible for under-eye bags by performing transconjunctival blepharoplasty. Generally speaking, after I perform transconjunctival blepharoplasty, your eyes retain their natural shape since the skin, muscle, and other support structures are not violated and are left intact. Some of the art in performing transconjunctival blepharoplasty is dynamically judging the effect of fat sculpting on your appearance as I'm performing the surgery. My target is to create the appearance as if you never had under-eye bags. Oftentimes, people with under-eye bags also have deficiencies in their cheekbone structure. Additionally, in your 40s and older, there is a diminishing in bone volume as well as loss of soft tissue, skin thickness, and fat volume. This is why I often combine surgery with the placement of long-lasting cheekbone filler at the bone level using a technique called structural volumizing. The fat pockets responsible for under-eye bags exist in specific anatomic compartments. When fat is sculpted from these compartments, it's unlikely that new fat will occupy these same compartments in the future. However, since there is still fat located further behind the fat that was sculpted, as aging and bone volume loss progresses, there is the possibility that additional fat may shift forward later in life. This means that the longevity of results is going to be different for someone who's having their procedure in their 20s in comparison to someone who's having it in their 60s. Speaking from experience, it's not unusual for patients to enjoy the results of their lower eyelid surgery for 10 to 20 years and even longer. As stated earlier, other aging changes can be addressed with volume enhancement, laser, and other surgical options. In my practice, I perform transconjunctival lower eyelid blepharoplasty using local anesthesia with LITE IV or intravenous sedation. My patients appreciate the advantages of this approach in comparison to the risks and recovery associated with general anesthesia. Usually I have my patients return to work in about a week with minimal evidence of bruising or swelling. If you're considering surgery for under-eye bags, you can be optimistic about the long-term benefits of this procedure. Since the human body is not permanent, future aging changes around the eyes and cheeks can be addressed as needed. I hope you found this information helpful. Thank you for your question.